For the past 8 years, the NFL has teamed up with the Urology Care Foundation to promote Know Your Stats campaign, which encourages men around the country to understand their personal risk for prostate cancer. Uh, Looks like 1 in 7 men will be diagnosed with prostate cancer, and there's usually no symptoms, and so it shows up very late, and they don't know it. So we want to make sure that the men out there are getting ready to go see their doctors and ask more about this disease. But joining us to talk about it is the NFL Hall of Famer, Mr. Michael Haynes, who is part of the best quarterback tandem in NFL history, right? Along with Mr.
Thank
Dr.
you.
Benjamin Lowentritt. How are you both?
Good, thanks.
Thanks for having us.
Okay, as a faithful member of Raider Nation, Mr. Haynes, it's a pleasure to have you this morning.
Thank you. Thank you, Mia.
And we'd like to hear a little bit more from you about your journey with prostate cancer. You were diagnosed at an event for the Pro Football Hall of Fame?
Well, actually, that's where the conversation started. I really wasn't diagnosed there. That's where they did a blood test and a digital rectal exam. They started to get my family history or asked for my family history. And I didn't know that prostate cancer ran in my family. When they gave me the stat that you gave there, the 1 in 7 men would be diagnosed with prostate cancer in their lifetime, that seemed like an awful lot of men to me. And so when I got back home, I called my primary care doctor, and we talked about my PSA, and he realized that my PSA had risen over the last couple of years and recommended I go for a biopsy. And mainly, I think he recommended it because I didn't know my family history. If I had known my family history, I probably would have been in for the biopsy anyway. But that's the only way you can tell that a person has prostate cancer is the results of the biopsy.
So the screening process, though, is very simple, but it seems that many men defer it or delay it. Is there a particular reason why?
I think it's because they just are ignorant. They just don't know their family history. They don't know anything about the disease. Men don't talk about it. Unlike women, I think because of childbearing years, they've been talking about their health in their early 20s. There's nothing really that men talk about when it comes to their health until they get in their 50s. And as a result of that, there's not a lot of awareness out there.
Dr. Lowentritt, when men are diagnosed and the treatment begins, do you find that they are sharing the information with their families at that time once they find out, or are they? I've known many men who seem to kind of suffer in silence, so to speak.
You know, it's a great question because I do think that many men try to think, well, I don't want to burden anyone else and I, with the disease. And when I have a patient who's being diagnosed, I'm really encouraging them to bring in a family member, wife, friend, someone, because that support is so essential for anything that you might go through. Also, when we're talking about some complex issues, it's better to have 4 ears than 2. Most men, when they hear about the disease, they start to zone out and they immediately go to the worst possible thing. I mean, the great news is that most men with prostate cancer are going to live a full, healthy, normal life and not be impacted by the disease. But that doesn't mean that we don't have to have some difficult conversations. So having someone else with there, having the support of your family or from other survivors is really essential to getting through this in the most healthy way, I think both physically and emotionally. Because a cancer diagnosis, even when it's not the most aggressive form of cancer, is something that puts a burden on somebody. But there are a lot of resources that we have, both with people like Michael and other survivors and networks that are out there, but also resources for the family and for the patient that can really help. So I think your point is great in that men shouldn't be kind of hiding these things, but we do tend to. So we got to get past that.
Are there any fears then around procreation or sexual performance that are inhibiting men from discussing this too?
I think there's a lot of information out there about prostate cancer that's not necessarily up to date. Certainly because of where the prostate is, and frankly, the prostate is a part of the urinary system, and it's also a part of the sexual function. Not necessarily in helping men perform, but in helping in being part of in reproduction. So, it is a delicate area, and it's something that people don't necessarily want to talk about freely. But it is not something that has to, just because you have prostate cancer doesn't remove those other activities from your life, and you can still have a very full, happy, and fulfilling sexual and functional life after a prostate cancer diagnosis. It's just important to start those conversations.
Great. Mr. Haynes, after your diagnosis, treatment, and then you were ultimately cleared, is there a particular medical regimen that you have to follow now, or are you just okay?
Well, immediately after the surgery, I had to, see my doctor maybe every 3 months or something like that for the first year, and then, just worked out, less and less, and now it's been several years, and so I see him once a year. Actually turned into being my golf buddy. He's a football fan, and so I see him quite regularly. But I'm living a normal life. As Doc was saying, is that if you deal with this early, and there's no real reason that you're not going to have a normal life, and my life is back to normal.
For either of you, are there any lingering mental issues, or do you recommend therapy as part of the treatment?
I wouldn't say that generally people need like psychotherapy or counseling in that respect. But as we were talking about before, I think having that conversation, having that support system around you is essential. I don't know, Michael, if you have anything to say from the patient perspective, but usually it's not that severe of a disruption to your life. It's really more getting over the hurdle in the initial discussions.
What are some of the symptoms then that men out there can look for, or maybe that their partners can notice and prod them to go to the doctor?
Yeah, I think this is where it's really important to the message we're trying to get out there, that it really isn't that there are any symptoms. If you wait till you're starting to have symptoms to see if you have prostate cancer, very often those symptoms will only come up when the cancer is no longer curable. So the entire message is to be aware of your own personal history, your family history, understanding that African American men are at higher risk. It's about 1 in 7 men, as you mentioned, overall, 1 in 5 African Americans. And if you have a family history of prostate cancer, 1 in 3 chance that you would have cancer yourself. So know what your father, any uncles, brothers, if any of them had prostate cancer, and then make sure you start to have that conversation with your doctor early on. There's very little that you would notice until it's really too late. So it's important to kind of be your best advocate early on, get out there, understand it's a simple blood test, a simple exam, and start to kind of take charge of this.
Okay, great. Well, thank you both for the information. I can't let you be on here, Mr. Haynes, without asking you a little bit about the season. Are you ready for football?
I am ready for some football, absolutely.
And what do you think about the Raiders' chances coming up this season?
Well, I actually think that the Raiders have a good chance of making the playoffs. I also thought that last year, and they were really exciting to watch. But I think Raider fans will be disappointed if they don't make the playoffs this year. They have a young team, a lot of energy, a great coach, and I just hope all the uncertainty about are they going to be in Oakland or are they going to be in Las Vegas, I hope that doesn't become an issue. But if they can just stick to playing football, I see them in the playoffs this year.
That's awesome, and I have to ask for my stepfather about your other team, the Patriots. So,
you are blessed.
He's a big fan. He has a whole Patriots man cave. So, what do you think? Do you think that 4-game suspension will impact the team?
Well, I actually think that the Patriots are going to do well in those first 4 games, but it's the next 4 games that I think, whoever they have on this schedule, they better watch out, because Tom Brady is. He's going to be upset. I mean, he's already upset. I really, my hat is off to him the way he's handled this whole situation. But missing 4 game checks, that's not a lot of fun for an NFL player.
Yeah, the scariest thing for the rest of the league is a mad Tom Brady. really think so. Well, thank you, gentlemen, both for joining us this morning. You shed light on a very serious topic that's out there. And all of those men who are in the black hole, don't be afraid to go see your doctors and find out more about prostate cancer. Is there somewhere they can go online and check, or for the NFL, do they have any resources that they can reach?
Well, the best place is the website, knowyourstats.org.
Okay, so that's knowyourstats.org. We'll also have a link on the site.
Great.
Well, thank you both so much, and have a great morning.
Thank you, Mia.